Yeah, would love to walk you through that. So a really formative experience for me growing up was my mom started her own in-home daycare center, and for over a decade, she would, provide these in-home daycare services, and I was her right-hand man. So I would help with marketing, I would help with operations, and it was a really transformational experience for me to like really see when you're able to care for children at such a young age, how you could like transform their lives, for the rest for the rest of their life. And I think till this date, we still stay in contact with a lot of those parents and a lot of those children as well too. Um, in my professional career, I actually learned a lot about growth marketing as well as unit economics from the ex-head of growth of Shopify. And his entire thesis was, if you really understand the unit economics of the business and you understand like the leverage point to increase growth, you can like really speed up the growth of these technology companies. So I was really fortunate to learn about unit economics from him. And then my previous role, kind of before joining Finny and starting Finny with Yilin, was I was the chief marketing officer of a large telehealth conglomerate in Canada called Jack and Jill Health. We were the Hims and Hers of Canada. And what was really important with that experience was, COVID happened, so healthcare really had to innovate. And what I really got to see at the ground floor was how important telehealth services were, as well as how important getting people their meds were as well too. And that really was like the impetus and like the passion that drove, myself to build Finny as well too. And one thing that I really wanted to do when we started Finny was how do we align kind of not just the patients and the providers, but patients, providers, and payers. And that was kind of when I met my co-founder, Yilin. And Yilin has like a very similar background to me as well too. So, he is the son of immigrant children who immigrated from China to Canada. And his experience was in undergrad, he actually did his degree in computer science. So, he comes from a technical background, and a very formative experience for him growing up was his mom lost her job. And in that experience, she actually started up an online pottery store. So he really saw firsthand how important entrepreneurship was. In his career, he worked at Shopify, and I think kind of the one thing that we really jived over was he felt that like the technology at Shopify is so powerful, but don't want to help more people kind of drop ship more t-shirts online and get stuff that maybe they just don't need. So what we did was we wanted to create a platform that enables these autism care providers to work for themselves. And that was kind of how we founded Finny together. Yeah, so I think just at like a market level, what folks need to see is that there's 54,000 of these autism care providers called BCBAs, and there's over 1.8 million Americans diagnosed with autism. One trend that we're seeing is there's been like a 200% increase since the 2000s of autism diagnosis. So it's a very demand-heavy market with not too much supply as well too. As we started investigating more of this market as well, Dan, what we noticed was the majority of these providers worked at private equity-backed clinics, and they felt like they wanted to operate on their own. They felt that they wanted to deliver more autonomous, ethical care, and kind of the obvious question we asked them was, hey, like if you'd like to branch out on your own, why don't you do so? And the answer we got from these providers was it's operationally and financially complex to do so. And that was kind of the idea to build Finny. And what we do at Finny Health is we enable these providers to go and start their own in-network ABA practices. And Finny helps them with 4 key things. Number 1 is we contract and credential them with state Medicaid as well as commercial payers. Number 2 is we provide them with the full stack platform where all the way from a parent inquiry to data collection is done in our platform. Number three is we serve as a PEO for any staff that they would like to hire underneath them. And then lastly, where Adonis comes into the picture is we will bill and collect on behalf of our providers. Yeah, I would say like on a first principles basis, like we really at Finny believe that technology is the greatest equalizer of bringing down the overall cost of healthcare. And kind of in our pursuit of finding a partner that really aligns with that vision, what we were looking for in an RCM vendor was, hey, do these folks actually want to build a technology first solution that will actually integrate into our EHR? And when we were evaluating vendors, a lot of folks wanted to be built off of legacy systems within the ABA space. Um, and our kind of custom out of the box EHR was just like not a good fit for them. Whereas when we first, approached Adonis and had these conversations, it was a challenge that, Adonis was actually wanted to build this with us versus shying away from not using some of these off-the-shelf EHRs. So that was like one of the big draws for us to initially start with Adonis. Now, on the other half of this is a lot of RCM still is done by humans and it has to be done by domain experts. And I think one of the things that allowed us to trust Adonis as well too is the go-to-market is to also bring on support staff who are deeply embedded with our billing and also will fight tooth and nail for each claim that we send out. So a combination of using our tech stack, hiring folks who are experts in ABA, allowed us to go further with our partnership with Adonis. I think one of our first product principles at our company is how do we enable providers to do less administrative work and actually focus more on caring. And when we look at the value chain of the things that providers are focused on, it's worrying about things like contracting and credentialing. There's no easy way for a provider to actually look into, hey, I'm in network with this payer and I'm hiring the staff, they'll be anticipated in network these dates. That solution doesn't exist today. That's something that we're going deeper on. On the actual data collection front, there's just so much work to be done on the sessions that these providers deliver as well too. So, looking into and really shadowing providers and seeing how can we make this clinical note-taking as efficient as possible? How can we build software that doesn't go out for 2 to 3 days at a time like other legacy softwares where providers have to actually do things by pen and paper, which is just extremely frustrating. And then on the really exciting front on the billing side is a lot of these providers are just used to pen and paper billing, downloading CSVs and sending that into insurance companies. What's really exciting is, using technology to hopefully be able to show providers, hey, you have completed this session. This is the estimated revenue per this session. These are the staff costs for this session. And being able to work with a technology provider where we'll send claims in and actually once they're paid, we could post it back and show providers as well too that, hey, we're collecting on this percentage of revenue within this time frame. And just being as transparent with our providers as possible. So again, they're not focused on worrying about all these administrative tasks and they're just locked in on providing the best clinical care possible. One of the really fun strategies that we have at Finny is that, we want to enable passionate providers wherever they are in America. And as a part of that, we need a partner who's willing to do the dance with us and be able to learn all of the different nuances in these different states. So what's been really helpful with Adonis is whenever we sign up a new practice to launch, a new provider to launch, we let the team know that we're going to be launching in this state. We're going to be working with this payer, as well as this is an anticipated go live date. And one thing that we've been really fortunate to have with Adonis is that we're able to like track towards those timelines really quickly. And you guys are able to give us, hey, we need these enrollments done. We need to verify X, Y, and Z, and then give us the green light for billing. So we have never felt that Adonis is becoming a bottleneck for us, but someone who's like, kind of cheering us on to make sure that we can launch and cover as many families as possible. Yeah, for sure. I think for us, what we're really excited about is seeing some of these products like come to full fruition. So, for example, we've been using revenue intelligence a lot, and I think one thing that really frustrates provider-led organizations is, hey, we're billing this much money. How much is tied up in AR? And if this much is actually tied up in AR, like what are the reasons as well too? And you can really see the vision and the product play out with Adonis as well too, where you're able to go into that platform, you're able to quickly decipher and pull insights that, hey, like this is why these like claims are being held. If anything is out of the norm, we're able to jump on top of it. And I think what we're really excited about is how do we keep, getting all that data passed on to us, but how do we build the motion and the learning so that over time, that AR we understand is going to be paid out in 30 days. And if there's any anomalies, we're able to jump on top of it. And we're just like really excited that the more and more we work with Adonis, the less of those problems we're having over time. And hopefully, knock on wood, in the future, we can get to a point where we have contracts across the entire United States with all Medicaid and commercial payers. And we're able to build up a workflow where it's completely hands off for both parties and just completely enabled by tech.